Hello everyone, welcome back to this discussion on stroke. Today let's discuss about the most important aspect of stroke, that is stroke prevention. In case if you have not watched the first two videos of this series, I would request you to watch those two videos before coming to this. The topic of stroke prevention can be divided into two categories, the general measures and stroke specific measures. Let's first discuss the general measures. These are the same thing which you may have heard about heart health or the routine healthy habits. I'll just try to explain to you how each of these points reduces the chance of you getting stroke. Control your blood pressure. If the blood pressure remains high for a very long time, it leads to gradual changes in the blood vessel architecture. The wall of the blood vessel carrying blood to different organs of the body has three parts, that is the intima or the inner layer, the media or the middle layer, and the adventitia or the outer layer. The media or the middle layer has a type of muscle called a smooth muscle and a protein called elastin. Now both these together are responsible for change in the diameter of the blood vessel as and when required, like vasodilatation, which increases the diameter of the blood vessel when the heart pumps blood into the blood vessel, and vasoconstriction, which decreases the diameter of the blood vessel. Long-term hypertension causes hypertrophy or increase in the size of these smooth muscles, decrease in the elastin protein content, increased abnormal deposition of a type of fiber called collagen in the media. Now collagen is a type of fiber which is normally present to some extent in the adventitia. Now, because of hypertension, there is increase in the number of collagen deposition, especially in the media. When all these changes take place, blood vessel wall becomes thick. As a result, lumen becomes narrow. Moreover, the elasticity of the blood vessel decreases, making the blood vessel stiff. As a result, the blood vessel cannot dilate as and when required, and it leads to increased resistance to the flow of blood, which again increases the blood pressure, forming a cycle, one leading to another. As the blood pressure remains high for a long time, there is increase in the turbulence of the blood inside the blood vessel. Now because of this, there is continuous injury to the innermost layer of the vessel. Now this injury leads to repeated clot formation and cholesterol plaque formation inside the blood vessel wall. Now this plaque, obviously as it grows towards the inside of the vessel, it leads to decrease in the lumen size and hence decrease in the amount of blood that can go through the blood vessel. And also this repeated trauma to the blood vessel makes the blood vessel as such weaker. The final blow is also given by high blood pressure. Now what happens is, because of the turbulence in the flow, it may dislodge one of the plaque and carry it along as it flows to a narrower blood vessel, occluding it completely, causing ischemic stroke. And because of the high blood pressure, the vessel, which is already weakened by this repeated trauma, may also rupture, causing hemorrhagic stroke. I hope you understood this mechanism as to how blood pressure leads to stroke. Controlled diabetes. Long-term high blood sugar level causes what is called as glycosylation of proteins, that is abnormal deposition of glucose in some of the proteins. You may have heard this term glycosylated hemoglobin or HbA1c, which is measured to check the long-term sugar control. Similarly, there is glycosylation of proteins in the blood vessel wall, making their function difficult and again leading to ischemic as well as hemorrhagic stroke. As obvious as it is, long-term high cholesterol again causes the same problem. There is deposition of a type of lipid called as LDL. You may have heard this term. LDL gets deposited in the inner layer of the vessel wall, causing a cholesterol plaque. From here on, as I already explained, there is possibility of both ischemic stroke, and also as the vessel wall becomes weaker because of this, there is also risk of hemorrhagic stroke. Smoking is a major factor which is again responsible for stroke. Now smoking affects the vessel wall, making them weak and making the patient again prone for stroke. Anxiety, depression, high stress level, all these things also lead to stroke indirectly by causing hypertension or a high blood pressure because of release of various hormones in the body. Apart from these common factors, there are some rarer factors like increase in the abnormal amount of a type of amino acid called as homocysteine, or some of the inflammatory conditions like lupus, rheumatoid arthritis. All these things also increase the risk of stroke, but let us not get into detail about all these rarer factors. These factors which I mentioned are so-called modifiable risk factors, while there are a few risk factors about which you cannot do anything, that is non-modifiable risk factors, like family history and genetics, ethnicity, that is Indians are more prone for getting stroke, and age. As the age advances, the risk of getting stroke increases. Apart from the obvious methods like regular consultation with your doctor to keep your BP, sugar, cholesterol under control, you need to bring about some major lifestyle modifications in your life. Regular exercise, or it could be even walking for about 30 to 45 minutes every day for 5 to 6 days a week. Your exercises could be stretching exercises, aerobics or weight training, whatever it is. Quit smoking. This is the most important thing that you can do to stay away from stroke. Develop healthy food habits. I know this healthy food habits is a very vague term, but I do not want to get into the details of it right now because in the future I intend to make a lot of food and nutrition related videos. But in short, I can say stay away from processed packaged food, stay away from sweets and the sugary foods along with cold drinks. Try to reduce stress in day-to-day life. It is another very important aspect, along with getting adequate amount of sleep every day. Once you are above the age of 35, I would advise you to have regular checkup with your physician at least once in 2 years, even if you are asymptomatic, so that these risk factors can be picked up in time and can be tackled before they cause some irreversible damages in the blood vessels of the brain, heart or other organs. Now coming to stroke specific measures, there is something called as transient ischemic attack or TIA, wherein a patient has paralysis of a body part exactly like a stroke, except that it lasts only momentarily and the patient reverses back fully to normal. In simple words, it's like a trailer of a mega movie to come. It's a warning sign that your body may give you before having a major stroke. In case a patient has a TIA, he or she needs to be thoroughly investigated so that an impending stroke can be avoided. We do imaging studies of blood vessels from heart all the way till interiors of the brain. Now in case if a cholesterol plaque is detected, it causes narrowing of the lumen of the blood vessel in the neck. As a result, the amount of blood reaching the brain gets compromised, and it may be possible that a piece of it got dislodged, went to the brain and caused TIA. And if it is left untreated, it may also cause stroke in the future. Now if the size of the plaque is large enough and the lumen is compromised to a certain extent, then we may have to place a stent in the neck vessel. That's called as carotid stenting. Or sometimes we may have to do an operation called as endarterectomy, where we open the vessel, remove all the plaque and then stitch the blood vessel back. Apart from this, the patient also needs to take care of all the general measures like keeping his BP, sugar, cholesterol under control. Doctor may also prescribe a low dose of a blood thinner like ecosprin or clopidogrel to reduce the risk of ischemic stroke in the future. So, to sum it up, healthy stress-free lifestyle with regular exercise and clean diet, avoiding smoking and strict adherence to medications for keeping BP, sugar, cholesterol under control is the key to stay away from stroke. Another equally important factor is awareness of the warning signs of TIA, and timely consultation in case of TIA or stroke helps to keep the patient safe in case of stroke. So, I hope you liked today's video. If so, give it a thumbs up, share it with your friends and family. And for more health and wellness related videos, subscribe to this channel. Thank you.